spine.
Posterior superior iliac spine is back here. That's the one that's responsible for the dimple back there.
Posterior inferior spine.
Posterior inferior iliac spine.
Greater sciatic notch.
Greater sciatic notch.
The body.
Body.
Ischium.
Okay, the ischium is this part down here. It has the borderline's about right there. And it's all this part back there and about up to there. And goes around like that. And this reinforced part, anyone remember the name? That most of you were sitting on? Ischial tuberosity. And the reason it's reinforced is because it bears a lot of weight when we sit down. Probably an evolutionary thing over the generations. We put all that weight on it. And so I bet you when we were on all fours, it wasn't reinforced like that.
Ischial spine.
Okay, the ischial spine, it's right there.
Ischial tuberosity.
Ischial tuberosity.
Inferior ramus of ischemia.
Okay, inferior. You really don't need to say inferior ramus because there's only one ramus of the ischium. The pubis has two rami. So you need to say superior, inferior, but I mean technically there's only one ramus in it. The ischium ends about right there. And there is no superior ramus of the ischium, so you can say it if you want though.
Lesser sciatic notch.
Okay, the lesser sciatic notch is below the ischial spine. It's that part down there. Okay.
Pubis.
Okay, the pubis is this part here. And goes from inside the acetabulum and all this part, smallest of the three bones. Okay. The most anterior.
And acetabulum.
Acetabulum.
Pubis symphysis.
Okay, pubic symphysis, of course, is where the two coxal bones join.
The acetabulum, can you point it on this, like turn it in the whole?
Yeah. The socket of the hip joint.
Inferior pubic ramus.
Okay, we have the inferior pubic ramus right in there.
Superior pubic ramus.
And the superior pubic ramus.
Obturator forum.
Obturator foramen. Usually foramina are little holes. Did I ever ask you that? I never asked that. Maybe I should put it on the midterm. The plural of foramen? Foramina. Fair game still.
Femur.
Okay, the femur. And indeed, the midterm is the next event we have, isn't it? The lecture midterm. So, one thing about having it sooner is it covers less stuff.
Head.
The head,
Anatomical neck.
the anatomical neck is just behind the head.
Greater trochanter.
Greater trochanter, important anatomical landmark.
Inner trochanteric line.
Okay, the intertrochanteric line you really can't see. It's on the anterior side, goes in between the trochanters, absolutely nothing there. You can see it on a real bone though.
Inner trochanteric crest.
Intertrochanteric crest though is quite visible.
Lesser trochanter.
The lesser trochanter,
Trochanteric fossa.
that trochanteric fossa is this little depression back up in there.
Linea aspera.
The linea aspera is this line right there. Just when you think they're gonna call it tuberosity, they call it something else. So,
Body.
body, just to make a great club. I'm sure it's been used throughout the ages as that.
Adductor tubercle.
Okay, the adductor tubercle is medial. And it is on the superior aspect of the medial epicondyle. It's right there. How do I know that this is medial? Well, this is
Socket.
because of the way this goes. This has got to be the medial epicondyle.
And then media epicondyle is next.
Yeah,
Lateral epicondyle.
lateral epicondyle,
Lateral condyle.
lateral condyle,
Medial condyle.
medial condyle. It's very obvious how the knee works.
Fovea capitis.
Fovea capitis, this depression. Fovea is a little depression. Fossa is a bigger one, usually.
Patella.
Okay, so it's appropriate to mention the patella, and the patella remains stationary when you bend your knee. It would have to, because you see all that ligamentous material holds it in one place, okay? And it tracks on the patellar articular surface there as you bend your knee. And is this a right or a left femur?
Right.
It's a right femur, isn't it? Okay. And so let's see how we tell whether this is a right or a left patella. First of all, this rounded part has got to be the anterior surface, doesn't it? Because you know your kneecap is kind of rounded on the surface. Okay. And this just looks like an articular surface back there. Okay. Not only that, but the pointy part is inferior. It's always pointing down. So if this is anterior and if this is inferior, then this has got, you know, this is the front side. This is the way it sits on the knee. So then you turn that around and you see two articular surfaces. One is considerably larger than the other. If the larger one is on the right, it's a right patella. If the larger one's on the left, it's a left patella. Okay? And so because the larger one is on the right, this is a right patella, so it's no surprise that this one articulates beautifully with this patellar articular surface, fits right in there, see? If I took a left patella and tried to fit it in there, it wouldn't fit at all. See, so you can actually tell right or left patella. Kind of cool.
Articular surface.
Articular surface, the backside. Larger articular surface is always lateral.
Patellar ligament attachment.
Okay, down below here is the patellar ligament attachment. It's called a ligament. Remember, there were collagen, gobs of collagen on both sides, up inferior and superior. But we call the inferior one a ligament because it attaches to a bone. We call the superior one a tendon because it attaches to the quadriceps. See? But it's really the same piece of, this is just encased. You really can hardly see it. It's encased in ligamentous, collagenous stuff. So, and this is another way we stabilize the knee. It kind of holds the knee stable as you bend it. So, and there's a little bit of tension there as it's held against the femur, as the femur rocks back on those condyles of the tibia.
Quadriceps tendon attachment.
Okay, quadriceps tendon attachment is up above. So you always got to remember that this pointy part's the inferior part. Okay.
Muscles of the hip.
Muscles of the hip. Very good stuff.
Psoas major.
Okay, so looking up here, so this is, we see right there would be the symphysis pubis, and gobs of muscles attached there. Okay, and there's the as-is, whole bunches of muscles attached to the as-is, don't they? The anterior superior iliac spine. And inside, this is the iliac crest right there. And inside there, we see the iliacus, which is nestled in the iliac fossa. Okay. Over here, we see psoas major, and those two muscles work together to stabilize the vertebral column, okay, which is right there. And they, of course, this happens bilaterally, and so you put tension on those, on this system of muscles here. By putting tension alternately on both sides, we stabilize the spinal column.
Iliacus.
Okay, the iliacus. Where's my little pointer here that I had?
Underneath the femur.
Oh, thanks, appreciate it.
Gluteus maximus.
Okay, gluteus maximus. Largest muscle in the body.
Tensor fascia latae.
Okay, tensor fasciae latae, which I just love to ask, is this one that runs down the side. It goes from the anterior superior iliac spine down here to the lateral epicondyle. It is an abductor.
Is there a vastus lateralis?
Oh, yeah.
I thought that was it.
Okay. Vastus lateralis is over here.
Gluteus medius.
Gluteus medius is underneath the gluteus maximus.
Piriformis.
And if you see me take this off, you know I'm going to ask piriformis, which is that one there. It attaches from the greater trochanter over here to the sacrum.
Can you turn it just this
Oh
way?
yeah, sorry about that.
Uh-oh.
Good catch. Okay.
Can you see the gluteus medius?
The
somewhere?
gluteus minimus,
Yeah.
I was looking for it and I'm not seeing it.
Or the medius.
Oh, the medius is right here.
Okay.
Yeah, pretty easy to see.
Sartorius.
Sartorius is this one that crosses over here. So it goes from the anterior, the Taylor's muscle, from the anterior superior iliac spine, which is lateral, over here to the medial epicondyle.
Quadriceps femoris.
Quadriceps femoris are all four of these muscles, which I won't ask because I'll ask them separately.
Rectus femoris.
The most anterior muscle of the thigh is the rectus femoris.
Vastus lateralis.
Vastus lateralis.
Vastus medialis.
Vastus medialis. And if you see me take this off, then I'm going to ask vastus intermedius, which is underneath it.
Pectineus.
Pectineus. We just see, it's quite a large muscle, but we just see a little bit of it right there attaching to the symphysis pubis. Okay, so let me turn that around. Pectineus.
Gracilis.
Let me attach this back so I can get it off. Yeah, let me see. That one tends to come out all the time. We need to find some way. Oh, this holds it in, that's what it is. Yeah, good. See, you start taking these things apart and we sort of have a cascade of negative events that occurs.
Gracilis.
Okay, gracilis is the most medial muscle on the inner thigh. And it goes from symphysis pubis down to the medial epicondyle. Once you locate the gracilis, you can locate the two adductor muscles, which are on each side. Okay, so here's gracilis, and The larger of the two adductor muscles is adductor magnus. The smaller of the two is adductor longus. So the two adductors are on either side of the gracilis, right down the medial thigh.
Biceps femoris.
So now we get into the hamstrings on the back side. And laterally, we have, so this is medially. So laterally, we have biceps femoris over here.
Semitendinous.
Semitendinosus sits on top, is superficial to semimembranosus, which is underneath.
Can you turn that one? Can you turn that one so we can see?
Huh?
Can you turn that one?
Yeah. Semitendinosus, semimembranosus is the deeper one.
Okay.
Ischial femoral ligament.
Okay, would you mind moving that over?
This.
Yeah. This just demonstrates those ligaments beautifully. And it's very, clear cut and easy to see. The iliofemoral goes from the ilium down to the femur, okay? And so here we have the ischium down here. And so the ischiofemoral goes from the ischium over to the femur.
Can you turn that a little bit?
Okay. And the pubofemoral is going to go from the pubis over to the femur. And I'll try and, so that's got to be pubofemoral, doesn't it? Okay. And all of this up here has got to be iliofemoral, because it goes from the ilium. And all of this down here is ischium, so that this part down here has got to be ischiofemoral. That's kind of the most ambiguous one.
It's all of them.
Yeah. So piece of cake. Yeah.
So next Wednesday is just going to be this.
So next Wednesday, we'll have a quiz over this, and we'll do our last anatomy lab before the midterm, which will be the knee and lower leg.
So the midterm lab is just going to be the knee and lower leg, it's not going to be all of them?
No, it's going to be all four of them.
Okay.
Yeah.
All 5 of them, so. how
Well, the
many-
first one was just terminology.
Yeah.
I mean, I
So
won't
we're not
ask
gonna
you
do
any
those?
stuff out of that. I mean, we've been doing it all along.
Yeah, so we'll just do the weeks 2 through 5.
2 through 5.
Okay,
Yeah.
just making sure.
Because we've been using medial and lateral and superficial and deep and
Anterior,
proximal and
inferior.
distal and been doing all that all along.
Oh, my knees
Yeah,
are killing
so-
me. I need to bring a knee pad next